Thank you, Speaker. Questions for the Premier. The Ryan report estimated that the Richmond supervised injecting room saved over 60 lives in the past 5 years. Its demonstrated success is the key reason why the report by Commissioner Ley unambiguously recommended establishing a supervised injecting room in the CBD because it saves lives. With 1 or 2 fatal overdoses a month in the CBD, the highest rate of heroin harm in the country, has the government sought advice on the number of lives that will be lost as a result of the government rejecting the expert recommendation to establish a supervised injecting room in Melbourne CBD?
Premier.
Speaker, I thank the member for Brunswick for his question and make it clear that the government absolutely supports the inclusion of a medically supervised injecting facility as part of our overall policy framework that is a harm minimisation and health-led framework to supporting people who use drugs. And I want to put that absolutely on the record. I also want to make clear that in considering the response from considering the report by Ken Ley into the potential for a second site in the CBD, I would say to the member for Brunswick, it was not an unambiguous recommendation from Ken Ley. The recommendations went to, there are a number of recommendations, and they included the need for there to be community support and the needs of the community to be also considered alongside the needs of people who use drugs. I also point to the member for Brunswick that 90% of heroin deaths occur outside of the City of Melbourne. They occur in communities like mine. They occur in communities like mine a long, long way from the CBD, which is why in considering Ken Ley's report, in considering advice from the Ryan Review and from other health experts, we have provided a statewide response to a statewide problem, Speaker. This is a statewide problem. There are, as I said, 90% of all heroin overdoses and deaths occurring outside of the City of Melbourne, and that is why we have developed, alongside responding to the Ryan Review and strengthening the supports around the North Richmond medically supervised injecting facility, we are also strengthening supports for people who use drugs right across the state. It is why, for example, and we know the role of pharmacotherapy can play in supporting people who use drugs. That is why we are, and this was also a recommendation from the Ley report, that we strengthen the access to pharmacotherapy, an area that has been getting harder and harder to access, and that is why we are rolling out to the community health sector grants to strengthen the availability of pharmacotherapy. We're also rolling out better access to naloxone. We're also going to commence a trial of hydromorphone, and we're also going to place that trial in the new health hub in Flinders Street so that we can provide people who use drugs with access to treatment and also wraparound services. That is what we are responding to in the CBD, and we are also ensuring that people who use drugs and the people who love and support them can get access to these services across the state, because this is a statewide challenge and it needs a statewide solution.
On a supplementary question, member for Brunswick.
Thank you, Speaker. And the Premier is right. This is a problem that does occur in many other parts of the state, and it's a problem that's going to come to a head if and when fentanyl and possibly nitazenes become more prevalent in the injecting drug markets. Fentanyl, for example, is a synthetic opioid that's around 50 or more times stronger than heroin, and importantly acts faster, so it'll kill people before help arrives. Fentanyl killed around 70,000 Americans in 2021, and it has been detected in several shipments in Melbourne. Will the government reconsider its rejection of these expert recommendations if overdoses due to synthetic opioids become more common in Melbourne?
Premier.
Thank you, Speaker. And Speaker, I want to be clear, absolutely clear, that the statewide response we released a week or so ago is absolutely focused on providing support to people now who have opioid addictions. and the member's question went to the increased risk of other opioids coming into the market, and that is why rolling out pharmacotherapy now, more access to pharmacotherapy now, is so important, because pharmacotherapy now is the most effective treatment option that is available now for opioid dependence. But it's also why we are trialling hydromorphone, because it is shown that that is a treatment that is found effective where others aren't, and also naloxone, giving more and better access to naloxone, which can reverse the effects of an opioid overdose as the person is having that overdose, is about saving lives. This is a package that will save lives, which is why we are rolling it out statewide.
The Minister's statement.